name is Richard Mwangi, a consultant audiologist and audiovestibular medicine consultant, partnering with Ponea Health. And today we'll be discussing how often should the hearing be checked. Now, when the patient has been diagnosed with a hearing impairment, we always give a suggestion, or we recommend that the patient should have this hearing test be checked yearly, so that at least if they acquired the hearing aid, it can be reprogrammed again if the hearing loss worsens, and also just to check and progress how the patient is continue using the hearing device. If the patient got the cochlear implant, we also want to check how is the mapping or the program that they are using, so that in future we are aware that the patient is not getting less or getting more amplification, and then we safeguard what we call the residual hearing, or we don't cause more of a hearing impairment that may as a result of noise. Because one thing that happens in the hearing is that it's amplification. Amplification is more of a mechanical energy, and what it will do is that it will give more sound to the patient. And that's why we talked about the hearing test, which is very important, programming the hearing aid according to the test so that you don't over-amplify or under-amplify. If you over-amplify, you end up causing what we call noise-induced hearing impairment to an already existing hearing problem. The hearing loss, especially sensory neuro, when you say about the sensory neuro hearing impairment, is where you find that the nerve has been affected. It cannot be cured, but it can be rehabilitated using the hearings we have talked about, the cochlear implants we have talked about. Now, the hearing impairment, which you talked of conductive hearing impairment, can be cured depending on what exactly the problem is. Is it wax that is impacted in the ear canal? It is cleaned, simple cleaning it by the specialist, the audiologists and the ENT doctors. Or is it a perforation, in the middle ear, which needs to be treated, or the surgically, the condition is surgically improved by sealing the hole or the perforated eardrum. Or find if is it the fluid that has accumulated in the middle ear that needs to be treated with some antibiotics. And at this point, I want to give a disclaimer of the usage of the cotton buds that are commonly found in the supermarket. They are not supposed to be used in the ear canal. You'll find that there's small writing on those cotton buds that says it is not supposed to be used in the ear canal. Basically, what happens is that when you use the earbuds to clean the wax, you push more wax inside the ear. And instead of removing the wax, it's continue building up in the farthest part of the ear canal. So you find that to remove it, it has to be cleaned by the doctor. Now, other accidents happen when you use the cotton buds. You find that you may forget that you had put the cotton bud inside the ear, and somebody just come and, accidentally happens that pushes it inside the ear, and you end up perforating the eardrum. I also want to say that the cotton buds were made deliberately white because when you put it in the ear, it will come brown. It come out brown in color, and then you may think that you're doing a good job, which is not really a good job you're doing. You are worsening the situation. Thank you for joining us today in this discussion. You can book my services at ponea.com. We look forward in engaging you more in the next episode.